Welcome, Dr. Dorothy Dillard, Director of the Center for Revitalization and Research at Delaware State University.
Thank you.
Nice to have you on. And your department has received quite a prestigious grant, and it relates to COVID, which is loosely the subject of this interview series. So I thought it would be interesting to find out just what you're doing. So tell us about the grant. What is it and who awarded it?
We received the grant from the National Institutes of General Medicine Sciences, which is part of the National Institutes of Health, NIH. And we were afforded the opportunity to apply for a supplemental COVID-19 grant based on research that was already occurring through NIH funding, primarily through Dr. Melissa Harrington's work at DSU.
Great. Now, let's talk about what this will do for your research portfolio. I know you're trying to build it.
We are trying to build our research portfolio, and this is it fits perfectly in line with the work that we're expanding on and building on at DSU across multiple disciplines related to health disparities and the social determinants of health. So this will increase our knowledge base and help us bring in researchers from several different disciplines to contribute to that work.
Okay, we all know that COVID is disproportionately affecting people on the lower socioeconomic levels, as well as disproportionately affecting Black and Brown people. The two are often, coinciding. What are the goals of this research here?
Our goals are primarily to better understand decision-making, risk behavior change, attitudes of residents living in our most underserved communities in regards to COVID testing and also potential for vaccination. We know that there is quite a disparity in COVID and it parallels the disparities we see in other health conditions for residents of these underserved communities. Also tend to be minorities, and we need to have a better understanding of what motivates them to change behavior, what factors possibly prohibit access to health care, just that whole menu of barriers that contribute to the health disparities that we see with COVID, as well as historically with a number of health conditions.
Dorothy, historically and often there is a very understandable reluctance in these communities to open up and participate. How will the study work? Will you go door to door like the census? How will you target participants? How many in the sample?
We are very fortunate to have two well-established, strong community partners. We'll be working with Sussex County Health Coalition for Sussex and Kent counties and the Wilmington Community Advisory Council in Wilmington. And both these organizations have a long history of working in the community. They have been partnering with the Division of Public Health to ensure testing in communities that are underserved. So they already have that foundation, and we'll be able to build on that. And they will help us gain access to those trusted facilities, and whether they be social service providers or a community center, healthcare providers, clinics. So we'll be doing our study in a number of sites, and that will vary community by community.
Okay, so you won't be going door to door. For example,
No.
In Wilmington, you could be going to Henrietta Johnson or to Westside Health or maybe
Kingswood Community Center.
Yeah.
Yep.
And how will it work? Is it a series of questions, a questionnaire, interviews? How will it work?
We have two components to the research participation. One is a serology test, which is just a finger prick, and we will be testing for exposure to COVID there on site. And while we're waiting for that test result to come back, we will ask participants to complete a fairly lengthy 15-minute survey on an iPad, and we'll have research assistants available to help them if they need assistance with it. We'll be using several versions of that survey so that we make sure that it's appropriate for language. Haitian Creole and Spanish are the two primary ones in our study communities.
Okay, so you will probably be working then with people over 18. Give us a sense of who the population will be and how you will secure their participation.
We will be recruiting adults, so 18 and over, and we will be recruiting based on the race, ethnic, and gender composition of the communities that we're working in. So we've identified 9 study communities and 3 in each county so that we have equity across the state and understanding the needs of these populations.
Great. And how will this ultimately benefit these communities? What do they get given back to them for their participation?
Well, the direct compensation is in regards to a gift card that every time they participate, because this is a longitudinal study. So we will be interviewing our participants every 4 months for a year so that we track behavior change, we can track different sources of information that will affect their decision making around COVID testing, as well as the uptake of the vaccination when that becomes available. And we'll also be able to correlate that with their exposure to COVID across that time period.
But
so we will be
ultimately, though, you hope to deliver a better quality of care to these communities. Is that correct?
That is correct. And that's one of the things that has a longer, broader impact from our work, and that we will be able to inform public health as well as local healthcare providers about the needs and beliefs and attitudes of the population they work with, so that we can have a better understanding of effective public health messaging and public health access. And that will not only improve and address COVID, but also the other health disparities that we see in our underserved communities.
It's very exciting.
It is very exciting.
Is it interdepartmental or really just your department doing this?
It's a cross-disciplinary study. We have the input from a biologist, Dr. Melissa Harrington, and we have 2 sociologists, myself and Dr. Sharon Goodman, who will also have the statistical expertise for our analyses, and Dr. Belle Rogers, who's in the nursing department.
Wow. And when you are ultimately able to tabulate all of the data, will this be shared with other states, public health departments?
Yes, we'll be sharing it directly with the communities where we're working through our community partners. We'll be sharing it with providers throughout the state of Delaware, as well as Delaware's public health. But we also, since this is an NIH-funded grant, we will be sharing our data with others across Johns Hopkins University, for instance, and other universities throughout the nation who are doing similar work with COVID, so that we can contribute to the national understanding.
And my final question is kind of a selfish one. Will you have preliminary results so I can check back with you and hear how it's going?
We plan to be in the field and to start our recruitment and our first initial interview and testing in January. And It, takes a little while to start collecting the data, get it cleaned, get it analyzed. But if you want to check back in the spring, that would be fantastic. I'd love to be able to provide an update.
Oh, great. And how many participants again do you anticipate needing?
Our
One.
study sample across the 9 communities will be 1,200 participants.
Oh my gosh, that's very large.
It is large, but we've got 9 communities. So, and the number from each community is dependent on the size of that community. So when we talked with our community partners, they were like, how many? But when we broke it down by community, they saw that it was very reasonable.
Well, these communities certainly deserve a better delivery of health services, a higher quality level of health services. So fingers crossed, huh?
Absolutely. They do deserve it. It's long overdue. And we look forward to contributing to more effective and more culturally appropriate public health messages.
Dr. Dorothy Dillard of Delaware State University, thank you so much.
Thank you for your interest.
Talk soon.
All right.
Bye.
Bye-bye.